Dr. Hajela, thank you for joining me for this podcast. And my question for you today is, what about addictive personality? Like I have a mom, she keep telling me, I know my son gonna be an addict. And I ask her why, she telling me, yeah, because he is more rebellious, he is more like independent, and he always take like a wide range of risks. And he is like pleasure seeking or something and less cautious. So, and she's telling me all these traits, like this is an addictive personality because his dad was the same. What do you think about this? Is there something like addictive personality?
Well, that's a common observation from people who think of personality as something that is rooted in somebody's character. Whereas what we've been talking about, that addiction is a disease of the brain. So all these behaviors that you've described, your patient has noticed in her son, they're all symptoms and signs of addiction. So what I would say is that it's not really an addictive personality, it really is the disease of addiction as it is manifesting very, very early, that she's able to recognize because she knows addiction in her husband and her son's father. So this is very, very common. I tend to not focus on the term personality because personality is a composite of outward behavior, which is a manifestation of how the brain is functioning well or not functioning well. So with treatment of addiction, actually that personality will change. So that son is not relegated to that personality for the rest of his life, just as her husband and the father, if he got treatment, then his personality would change. When I was in medical school, there was a tendency to say that all people with addiction had an antisocial personality disorder. Because if you look at it on the surface, you can say drug use is illegal and anybody who's using drugs is being antisocial. So there's a tendency to call it antisocial personality disorder. Unfortunately, with that label, then the assumption is that that person can never change because that is their character, that is their personality. So what I encourage people to consider is that personality is not something that is fixed. Personality is something that all of us can recognize in ourselves as to what our vulnerabilities are, what our natural traits are, but then we can make healthier choices and then have a personality, an outward behavioral pattern that is very different than what it might have been if I didn't get treatment and recovery. So I try and emphasize that personality is something that is malleable. Now this is where people get confused, because if people are reminded and encouraged to make choices, they think, okay, so I made a wrong choice with addiction, now I'll make a better choice. But it's important to appreciate that addiction is not a choice because it is driven by factors that are more internal and biological, just as this mom has recognized in her son at a very young age. But then, even though that part of the brain is not working right, that is driving these behaviors and this personality appearance, if other parts of the brain that are healthier, they're allowed to develop, and especially in a child like that, it would be important to protect his brain from exposure to any chemicals until he's at least about age 25, which is what we know the chronological age that is required for a healthy development of the human brain. That if he's protected, then regardless of his genetic predisposition of addiction, his manifestation of the disease will be different. And that addictive personality that the mom has observed early, it can be mitigated. It can be modified such that the person can have a healthy, happy life in recovery, which would be very different than the behavior that mom labeled addictive personality early on.
Can I ask you a question not relevant to what we are talking?
Sure.
What do you think is the prevalence of the addiction disease? Like how many people have this?
Well, the disease of addiction, depending on where you look at it as manifesting, is different. So the traditional prevalence figures were about 10 to 20%. But we've come to appreciate that when you draw the line there, you're picking up only the severe end of the spectrum. So I actually say that the severe end of the spectrum of the disease that we are starting to recognize in society, it's at about 20%, because that's a third of about total number of people that have the disease. So another third, another 20% have what we call mild addiction, which other people may not call addiction, but once you appreciate what the definition is, and they're not having huge problems, but they're having problems similar to the people with severe disease, but with less frequency and or with less amplitude. And then there's another third, which technically if we do genetic testing and if we do some other clinical markers, that they're probably having some mild manifestations. So if you add up the numbers, if 20% have severe disease and 20% have moderate disease and 20% have mild disease, then that adds up to 60%. So the actual prevalence of addiction is likely upwards of 60%. So for easy numbers, you can say that 2 out of 3 people likely have addiction. And a third of the 2 out of 3 people have severe addiction, which society readily recognizes addiction. So we have a long ways to go in terms of understanding addiction. And if you think that there is so much confusion, there are a lot of people who think that addiction is not a disease or addiction is not even a problem because so many people have it. And with these numbers, because it's an endemic disease, meaning it's there in the human genome all over the world, it is a bit of a conundrum that it's a disease that more people have than don't have. So people with addiction are actually in the majority. And as I'm saying that, and I don't know if you're going to ask me this question later, but there is that evolutionary ecological phenomena that addiction as a genetic problem actually has had survival value, which is why I can posit that more people have it than not, because people with addiction do survive at a certain level and they propagate more. So I'll leave it at that, and if you have more questions related to that, I'd be happy to explore that more.
Okay, yeah, we're gonna go back to this point again, but we are covering now why roots and the causes of addiction, like what are the roots and the causes of addiction. So what do you think about observation? Like if kids like they watch their dad or mom using drugs or drinking too much, or they cope with the stress through addictive behavior, that this can trigger addictive problem in the kids, or it is mainly genetic? Observation has no role in this. What do you think?
Well, observation does have a role, but I can take you back to the 1970s, where there was a sociologist named Al Bandura, who is really the father of what is known as social learning theory. And the hypothesis at that time was that the human child or the human infant is a blank slate, and he or she interacts with the environment, and that environment has a very predictable effect in development of that person. So people came to believe, and some people still believe, that environment is everything. But unfortunately, with that environmental approach, people discount the role of biology. And there have been many, many research studies that have clearly shown, including twin studies where twins separated from birth grew up in different environments, yet when they met many years later, they found themselves to be very, very similar. So genetics has a huge role to play in terms of how people observe. So yes, absolutely, we are products of our environment, meaning we develop in context of whatever we are exposed to. But how do we react to that environment and what happens is dependent on biology. So what that actually means is that if 2 people, one of them has the genetic risk factors of addiction, whereas another one doesn't, given the same environment, the person who doesn't have the genetic predisposition will not necessarily have addiction. Whereas the person who has the genetic predisposition, even in the best of environments, can have addiction.
There is a test to identify these abnormal genes that gonna end with addictive nature? Like, do you think there's a genetic test we can do or not yet? We have
Well, all the genetic research that I'm familiar with really is identifying many, many different gene markers. And the race is on. But what I can say to you, and since I've been following this line of research for many decades, some of the researchers have become friends because I read their papers and have a chance to talk to them. And one particular one that has been very well known to me, his name is Dr. Ken Blum, B-L-U-M. And he is the discoverer of the DRT-D2 gene, which is a dopamine gene, which is highly correlated with people with addiction. Now, one of the problems that Ken and I have talked about over the years, that it is hard to find good subjects where we can identify that yes, this person definitely has addiction, to compare with subjects who don't have addiction. Because there's a tendency to say this person is an alcoholic, that person is not an alcoholic, which in terms of what I've been saying, hopefully you can appreciate that we may sometimes end up comparing someone who has severe addiction versus someone who has mild addiction, who our usual testing and assessing methods haven't recognized as having addiction. So it becomes very difficult to do this kind of research. But Dr. Blum, for example, but many other genetic researchers have been working on this, and there have been many genetic alleles, they're called, that have been identified, and people are trying to develop tests. And Dr. Blum himself has developed a test where he looks at many different factors, and he's come up with a genetic addiction risk score. And I've been discussing this stuff with him, and the thing that we can say with fair confidence, that we can, anybody who has that test can at least be aware as to where their predisposition is. And if one focuses on a healthier environment, then we can either prevent complications due to addiction, and or we can catch the problem early and offer a much better quality of life to that individual, because with proper treatment and recovery, the person does have the opportunity to do that, versus not knowing and then taking certain risks, and before you know it, as you were asking me earlier, that if the person starts engaging in high risk behavior or drug and alcohol use at a younger age, then they get into trouble much faster, and the brain that was under the gun, so to speak, beforehand, then suffers even more complications, and then becomes harder and harder to treat as the person grows older.
Okay, thank you, Dr. Hajela. Before I leave you, I want to ask you one last question. If we compare the genetic contribution to the environmental contribution, do you think how much the genetic part contribute to developing addiction disease?
I think the number that I feel comfortable with, and you'll find a range in the research literature, but I tend to say that the number is probably 60% genetic and 40% environmental. That is the best estimate that I try and convey to people. It could be as high as 70% genetic and 30% environmental, because the idea that genetics has a large role to play is a very, very important concept, because it's something that people have forgotten in many ways or not appreciated, because the environmental contribution is also significant, and there's this whole field of epigenetics where people are trying to figure out what turns certain genes on or off. But because the disease of addiction is in the hypothalamus, which is a semi-automatic part of the brain, so this is where all the automatic functions in our human physiology and most of the semi-automatic are genetically driven, whereas things that are more in the cortex of the brain and things that we have voluntary control over, and we know that in terms of athletes, that we all have certain aptitudes and certain things that we like in terms of sports or activities, but to become good at it, environment has a large degree of effect. So that is more in the area where it's volitional behavior, whereas avolitional behavior and or strictly autonomic or automated functions in the body, physiology, they are largely genetically driven, which is why I say the proportion for the disease of addiction, which is in the midbrain, is likely 60 genetics and 40 environment.
Okay. Thank you, Dr. Hajela, for answering all my questions, and I'll see you for the next episode.